55. 40.
And we're live with Dancing with the Stars.
Don't make me laugh, Belinda.
All right.
No goofy faces. And we're live? Live. Not yet.
Should be rolling. Haven't picked up on the viewers yet.
We're rolling now? Okay. Hi, my name is Dr. Margie Corney. I'm here at Women's First, and I'm here tonight, to give you some information about a procedure that we do here in the office called SculpSure. It's a very unique and wonderful device that we have here at the office. It's designed to remove fat permanently, non-invasively, painlessly, and in 25 minutes. You can't do better than that. So let me just go forward and give you a little bit of information about this SculpSure technique and this procedure. The SculpSure is a way that we can place some plates on your abdomen. It targets certain areas of fat, and what it does is it uses the laser energy to actually penetrate through your skin into the subcutaneous tissue, and it actually causes destruction of those fat cells. The laser is actually applied, and I will be going through all of this with you this evening. I'm going to at least give you an idea through our lovely model here and our patient, Crystal. I'm going to give you some information about how the device is actually applied to the patient's body, how it works, and be available to answer your questions through YouTube. And during the procedure, you'll be able to send your questions in, as well as there's going to be some frequently asked questions that we have prepared that more than likely most patients want to know. And we're going to go in and answer those questions for you today. Again, the SculpSure is a laser in the form of a beam that is going to be directed through the skin. It is going to be directed to certain areas, and the areas of the body can be the lower abdomen, the upper abdomen, the flanks. It could also be the legs, the arms, and that pesky bat fat. So this is a procedure that's designed for those really stubborn areas that you've been trying to get rid of, but mainly haven't been able to do so through strenuous exercise and rigorous diet. And you're trying to do your best to get rid of these stubborn areas and haven't been able to do so. So it's a perfect fit for a lot of people out there that are trying their best to lose those fatty areas. So I'm going to go on and at this point kind of introduce you to Crystal. Crystal has come to the office today, and she'd like to get some areas taken care of. There's some areas of concern. So Crystal, I'm going to ask you, what are the areas of concern that you are interested in having this procedure?
My abdominal area.
Okay, so are we talking about the lower abdomen or the upper abdomen?
The lower abdomen.
The lower abdomen.
Yes.
And time-wise, why now? Why are you deciding to come to the office now?
It is an anniversary trip to the Bahamas, and I want to make sure that my stubborn fat is not hanging over my bathing suit. So I've been doing the crunches and the workouts, and nothing seems to make it go away. Well, obviously dieting. And nothing seems to make it go away. So I really would like to get rid of this lower abdominal fat that I have.
Okay. Well,
Want to look my best.
I hear you. And this is a concern of a lot of people that come to the office. They heard about cool sculpturing, and that's something that, a lot of people hear about. SculpSure is different, and it's better in my opinion. It's better because it's not painful. It is most definitely non-invasive, so there's not going to be any biting, any pinching, any pulling, none of that kind of thing. That is good.
That's good.
So it's a good thing to have. So we're going to do an assessment.
Okay.
Anybody that comes to the office that's interested in the SculpSure, the body has to be assessed. We need to see how we're going to configure the plates or the templates to the particular area so that we can be the most effective in being able to get rid of the fat. And so what I'm going to do is I'm going to let Miss Crystal step down. Just 1 second, Crystal, because I don't want you to fall over here.
Yes, ma'am.
I'm going to pull that down for you, and I'm going to have you step down. I'm going to come around this way, and we're going to do a little assessment of the abdomen. So what I want you to do, what I'd like for you to do, is kind of lower your pants right down to the area that we're concerned about. Okay. Now, normally when we do an assessment, we look at the entire body. We just don't kind of focus on one area, because there's a possibility we might be making an assessment that the patient might want to have other areas that she really wasn't, too concerned about. But now, after thinking about it and knowing how easy this is to get done, that she might decide to do other areas. So we're going to look at the whole body. And what I see definitely is the lower abdomen. Right here, you should be able to pinch an inch. If you can pinch an inch, then you know that you have subcutaneous fat that we could get rid of. And it would be safe to do this with the SculpSure. So I'm looking here, but I'm also seeing a little bit here and a little bit here on the flank. Now, granted, the lower abdomen is something that we can work on today, but with a treatment of the flanks, we can probably also get rid of fat here. The laser, the SculpSure, works by penetrating and targeting the fat cells, as well as disturbing the fat by breaking up the sexual integrity of the fat cell, and therefore this particular fat is absorbed into the lymphatics and is gotten rid of through the body over a period of time. So that's how it works. What we would see would probably be some differences in about maybe 4 to 6 weeks, but ultimately the treatment, you may not see the full benefit of the treatment for up to 12 weeks out. Okay, so this is the area that I think that we can treat today, and we're going to demonstrate how we put the plates on. Okay? So what I'd like you to do, Crystal, is come and have a seat up here. Okay? And I'm going to try to continue to ask some questions as we go on and apply the plates. And now it's time for our assistant here, Miss Kylie. Kylie's going to come in and she's going to go on and apply the plates. And first what we're going to do, Crystal, is I'm going to have you lie flat. And we might pull that back up, but right now we need to put it down, okay? And what we've already performed is we've tried our best to maybe go on and see what's the best position for the patient to have the plates applied. So what we've decided is that we're going to use a 4-pronged plate. I want everybody to take a peek at this. This is a plate that has 4 different plates to it. The laser apparatus is going to fit in each individual plate. So right now we're going to go on and apply this. So Ms. Kayla, can you go on and put that on? This is the area that we said that we were going to be applying the laser to. So I'm going to just kind of sit right here and allow my friend here to do all the work. But typically, this is what we do. We apply the brackets to the patient's abdomen or the area that we're going to be working on. And then what we'll do is we'll go forward and apply the actual laser to that area. And so while we are, while my very, very capable assistant is doing that, I'm going to be trying to go forward and answer some of the questions that we might have. Crystal made a point of saying to us that she's going on an anniversary trip I don't know whether or not you mentioned that on camera, but about 6 months from now, you're going to be going to the Bahamas. You didn't say that either, but to the Bahamas. And what we are suggesting is that it's very important that you plan ahead. So, for example, if you think that you're going to be going someplace special and you've been working with trying to get the fat off the body for some time and haven't been able to be successful, think at least 3 months down the line. Are we okay? Mm-hmm. Okay. So we're just going to apply these plates, and it's important to let the people out there in webinar land take a look at the device. Let's pull that down first before we put it on, Ms. Kayla. Pull it down, and let's let the camera, let's see, this is what the laser beam looks like. So this is actually in contact with the brackets, and although the laser energy is actually going to be delivered through this plate here, and this is going to be on the surface of the skin, there is not going to be any kind of heat that you're going to feel, because there's a cooling contact cooling process that happens throughout the process of the laser being applied. Okay, so far all we've done is we're applying these different brackets, and so now the laser is actually going on to there, and hopefully we're not going to have too much discomfort. But definitely, this is how it goes. And so don't hold your breath.
Okay.
You need to breathe. And so there will be somebody here in the office and in the room where the procedure is taking place throughout the entire 25-minute time frame that the patient's actually having the procedure done.
Dr. Corney, we have Michael from Brookings, Oregon,
Okay.
and he wants to know if this procedure works on fatty deposits in unusual places, like under the arms, for example.
Under the arms. So
Maybe like his chicken wing area.
the chicken wing area. So we're basically talking about underneath this area. Well, the laser, you have to be able to pinch an inch. That's the first thing. And the SculpSure is not really designed for tightening up skin. It's mainly designed to actually destroy fat cells. So it really is dependent upon that individual, you know, what their underarm looks like. So if we have a large amount of tissue there, it may not necessarily be the best way to get rid of fat. But, and especially if we have a dependent piece of fat and skin here, if you have hanging skin, it's not going to be the best. Now, if you have a small pocket of fat here, the SculpSure has been approved for you to use not only on your lower abdomen, but also on the upper abdomen, the flanks, the legs, as well as the back fat. The arms are something that is going to be approved, and so hopefully this is something that we'll have available to us to use the SculpSure at some time in the future. So you have to be cognizant of the fact that we really need to we really have to individualize our treatment to the individual, and so that might be something that we could do. We could do SculpSure on the arms, but maybe not. We have to do an assessment. And so the next thing that we wanted to talk about was, is it uncomfortable?
No, ma'am.
Well, the laser is typically something that this process, it has to be really, really, really close on. It has to have direct contact and no wavering of the apparatus. So most of the time the patient's in this kind of position, and of course it's dependent upon where the machine is going to be attached to the patient's body. And normally we give the patient a guide so that way she can tell us whether or not she's uncomfortable. And it comes in different stages. And can I just take that from 1 second? It will actually say if we're in zone 1, we have pleasant cool to cold feeling, and then we would possibly increase the setting. The next step would probably be gentle warming and cooling. The next would probably be tingling sensation, short intervals in warmth and cooling, and that's kind of the category that we're trying to get to. That tells us that we're having ultimate and the optimal amount of burning of fat tissue and actually destruction of fat. So this is something that we alter the degree of setting for the machine, and we're able to get to where we need to go in terms of fat burning process. And so a lot of people ask, we don't know how uncomfortable is it. We don't really want to make it uncomfortable. It's just an alternating of, I think most people would describe it, I had it performed myself to try to be able to know exactly what the patient is feeling. And my flanks were done, and I felt something that felt like a tingling sensation, maybe even like a little bee sting. It wasn't overwhelming, but it was alternating with a coolness, and that made the whole process tolerable. Would you say that that's kind of what you're feeling?
Yes, ma'am.
Okay, good. Okay, good. Some people ask also about cost. The cost of this particular procedure.
Right, Dr. Corney. Are we running specials right now?
Yes, so the specials are going to be, and they are right at present time, if the first 20 people to sign up to have the procedure done, and to have it done by October 1st, They will be able to have a very special price of $8.99. Now, after that particular, you can still save some money. After that particular date, the price will probably be in the range of about $999, but you could save some money by having the procedure done and signing up as soon as possible. The first 20 people are able to do that. We're going to give that special price, and that is a very special price. What else can I tell you about the SculpSure that people want to know?
Well, we have Richard from Virginia Beach, Dr. Corney, and he wants to know if someone can get this procedure multiple times or just once.
Okay, that's a good question. A lot of people ask that question because you may have one area that will take maybe more than one treatment. Ideally, the SculpSure is designed to reduce fat in any one particular treatment area by about 25%. So if you have the treatment in your lower abdomen one time, you're going to have a 25% reduction in the fat, subcutaneous fat in that area. If you decide, that's great, but I need to have more removed from that area, then we can do a second treatment. That second treatment probably can be done in the same area, but it needs to be done about 4 to 6 weeks after the first one. Same area, yes, it can be done again. Ultimately, to get the maximum amount, we do suggest that you have a series of treatments. So 1, 2 in the same area, and possibly up to 3 treatments in a particular area. So the more you do in one particular area, the better it's going to be and the greater fat reduction you're going to have. So the second treatment, you can get up to 18% reduction in the fat. So 25 the first time, 18 the second time. So that's a lot of fat being removed in that one particular area.
Okay, Dr. Corney, you mentioned earlier that you may start seeing results within 4 to 6 weeks. Is there anything that should be done after the procedure just to assure that they're receiving the optimal results?
Most definitely, you should continue with your exercise program. There's definitely 100% no downtime with the SculpSure. So if you have the SculpSure done today, then you can go back to your normal activity today. But it's very important for you to maintain your fluids. Water. Water is extremely important. So you need to have a great intake of water and continue the process you've already started, but just make sure you're taking in large volumes of fluid. So that's a very good question.
We have another question from Kelly from Newport News, and I think you may have touched on it a little bit earlier with the question about having it done in unusual places. Because Kelly wants to know if this is a procedure that can reduce her husband's man boobs.
Man boobs. Ooh, okay. Well, I mentioned back fat, but man boobs, no. One of the reasons why this is not a good place, the SculpSure hasn't been approved for breast tissue at all. But usually on the chest, we're really close to bone. And there may not be an area that directly below we're not encountering bone. And so therefore, it's not a good procedure to be done for man boobs. There are other things that can be done for man boobs. SculpSure is not one of those things, but liposuction is one of those things that can be done for man boobs.
Do you offer liposuction here at the office?
Yes, I do. I haven't talked to you about that.
No, ma'am, I have not.
Smart liposuction. Yes, we do liposuction here in the office. And we call it smart lipo for a couple of reasons. First, let me just say, smart liposuction is smart liposuction because there's no general anesthetic. You do not have to go to sleep. That means that we can bring you into the office, we would inject a local anesthetic, and people that have this done, they have no pain during the procedure. We would put that local anesthetic in, and we can very specifically direct the laser to where we want to remove fat. And so it's more tailored. It's something that we can put the laser in and melt the fat, and then go afterwards and, same setting, go and put a cannula in and directly remove the fat. It's called smart liposuction in my opinion because there's no general anesthetic, and the laser technology is such that it is protected with guides to prevent the tissue from heating up. So we don't we don't have accidents, we don't have problems with burns or injuries that sometimes a laser can cause. So that's the reason why it's called smart liposuction. But liposuction is one of the things that we do at Women's First. I would go on also and say some of the other things that we do with the smart lipo. A lot of people have questions about cellulite. Woo, cellulite's a big deal. It is a problem because the cellulite, there's creams and concoctions and rubs and wraps and all these kind of things that people have used in the past to try to get rid of cellulite, but cellulite can only be removed one way. And that way is to actually go in and break up the adhesions that are creating the cellulite. Cellulite is a combination of pocketing of fat with striations going through the skin that are connective tissue. So when you're doing cellulite removal, you're breaking up those adhesions, you're getting rid of the fat, and you're also tightening the skin. So that 3 process steps is very, very, very important in having effective cellulite removal. And that's something that we use the laser for as part of the smart lipo process. So cellulite, we do that here at the office, yes.
Okay, Dr. Corney, in regards to the SculpSure, we have a question from Bobby, who's from Hobson. And Bobby wants to know how long she'll have to stay off work after getting this done.
Okay, now that's kind of what we touched on already. There is no recovery time, so there's no downtime, actually. Some people have this done at their lunchtime. They come in, they have it done, and they go out. Now, if you're going to do more than one area at the same time, then it would be 25 minutes to do this one area, and then if it's a different area, say the upper abdomen or flanks, then it would be an additional 25 minutes. The plates would be placed in a different area, and then we would go forward with removing the plates and putting them someplace else.
Okay.
So it would be 25 minutes and another 25 minutes. And some people do this 25 minutes, and 25 minutes. So 3 areas be done at the same setting. And even with that, you still are able to go about your business that afternoon.
Is each treatment cost the same, or is it?
Each treatment, the treatment is based on the area. Okay, so what you're having done is one area. And so we try to get as much as we can possibly get with our 4 plaques. And so, but every time we apply the laser, it's considered to be a treatment area. And they're combination packages.
Latasha from Norfolk wants to know if someone with breast enhancement surgery can still get this procedure on those love handles that are right under the arms but kind of wraps around from the back to the side of the breast.
Okay, so this is something that has to be assessed by that patient with the provider, myself, individually, because we have to really kind of see where the fat that the patient is talking about, where exactly is the fat? Is it back fat? Is it flank fat? Which kind of fat? Where is it actually? And if it's possible, it would be possible if there is no contact with breast tissue. We don't want to incorporate breast tissue. This is not for breast tissue. So the augmentation area is off limits for the SculpSure. But some people actually have the fat pad in their back actually close and wrapping around close to where the breast tissue is, but it's not part of the breast. So the answer to your question is yes, it probably can be done, but we need to answer that by seeing that patient individually. About the technology, I just wanted to emphasize the importance of, and I know you've been on the machine, typically it's only 25 minutes, and I know that, this is something that can be uncomfortable if you're there too long, sitting in one position, but you still seem to be pretty comfortable with me, so you're good. Okay,
Yes,
so
ma'am.
we're going to keep on going. There are points that I just really wanted to make about the non-invasiveness and of the SculpSure. I'm just so impressed with the SculpSure in the sense that so many people want to have things done that are non-invasive, and this is something that does make a difference in people's lives. Because if you're working real hard to try to get rid of the fat and not able to do so, 1 or 2 sessions of the SculpSure and there you are, you're on your way. And we do try to work with the patient to try to make it as convenient as possible. So Belinda, you have another question for me?
Yes, I do, Dr. Corn.
And I just want to let the people that might be watching on the webinar, I wanted to make sure that they knew that there is going to be an answer, a time frame that we can answer their questions if we're not able to do it while we're doing this live. Those questions can be answered by you just writing your questions in and sending it to us, and we'll get back to you and set up an appointment for consultation. We'll do whatever it takes in order to make sure that we get you in here and get the procedure done.
Okay. Now, Dr. Corney, we do have an anonymous question. Someone who wants to have the SculpSure work done, but they consider themselves to be more overweight. Does the SculpSure really work on someone who's really, really overweight? Well,
there are limitations. And the way that we should look at it is what's more cost effective. For someone that has a BMI that's greater than 30, then we're talking about probably multiple applications to one area and maybe multiple applications to multiple areas. So it doesn't seem to be cost effective to do that when a better procedure would be the liposuction. And the smart liposuction, for the reasons that we talked about. One, there's no general anesthetic. Now, in the past, people have, when you talk about liposuction, people have this image of these big, giant cannulas going into portions of the body and large volumes of fat being removed. But the big deal with smart lipo is the local anesthetic. And the other thing is that we put the laser into the area that we want to remove the fat. And this is a different laser. This is a smart lipo. And then the laser actually melts the fat. So once the fat is melted, then we go back into the same incision and suck the fat out. So it's more tailored to specific areas, and you're able to take out larger volumes of fat in a one-time setting. Now with the smart lipo, there is a recovery time. And so there's some preparations that need to be made, some precautions that need to be made, and there is a little bit of downtime. The downtime is not necessarily that you're going to be incapacitated and not being able to move around. It's just going to be, you're not going to be able to do vigorous exercise for a couple of weeks. But you will be able to go on about your business the next day after you do the smart liposuction. You just have to wear a protective, supportive garment. And so we do consultations for liposuction here in the office.
Very good.
So I don't know if there aren't any more questions, and we're going to take you down from here and make sure that you are doing okay, and we're going to take a look at the site. So why don't you come on in, Miss Kyla. We're going to take this down, and basically you're just going to disconnect one for me first. You can do it in the order that you took them on, and whatever is convenient for you. Okay. And I'd just like to say that if we were at the completion of the procedure, we normally take a look at the area to make sure that it's nice and dry and there's no irritation or any blistering. That's never happened before, and it's not possible to happen with this particular machine, because the main reason is that there isn't anything having an impact on your skin. Hold on there, Miss Crystal. I know that you're ready to get out of here. But, and the area is clean. And so, can we let the people see, this is the bracket that we normally use, and also kind of let them take a look at the laser again. And that normally is cleansed, and you would normally, when you got ready to put that back in there, you just go on and clean that with the cleanser, and to make sure that it's nice and dry before we put it back into the machine.
Skin feels tingly.
Okay, well,
Yes, ma'am.
most people will say, myself included, that it feels only when I press the area after it was done that I could feel that it felt a little sore. But a little bit of ibuprofen, a little bit of Tylenol, and that does the job. And it doesn't actually persist. And I really didn't feel anything after the procedure was done. So, Ms. Crystal, it's okay if you want to come down from there, and I'm just going to step over here so that way we can continue to ask questions about, or answer questions about our procedure. I'm going to go on and make sure that you have some water,
Thank you, ma'am.
so that way we can start that process of you hydrating yourself a lot.
Yes, ma'am.
And Dr. Corney, while we're waiting for more questions to come in, I'd just like to add and remind our viewers of the Bring a Friend special that Dr. Corney mentioned earlier. She said that for the first 20 people to sign up, we will be offering the SculpSure session for $8.99. So we want to remind everyone to grab a friend, anyone over the age of 18. If we can pinch an inch, we can do the SculpSure procedure on them. Bring your mother, your sister, your husband, a
Yes.
friend, your best friend. You all can have it done together. So the first 20 people or 10 sets, couples can come, sign up. You have to have the procedure done before October the 1st to receive our $8.99 special. If you're unable to have it done before October 1st, you can still save some money. You can have it done after October 1st for the low price of around $999, and that special is for a limited time. So we want you to go ahead and give our office a call so you can come in for your free consultation and have you some SculpSure.
And that was our office manager, Miss Belinda Pitts, who's off camera, who's pretty shy, but we're going to get her in front of the camera next time. So thank you very much. I want to make sure that we invite you to our next webinar, which is going to be held on August 30th, 7:30, I believe that's the time. And we're going to be talking about FemTouch, which is vaginal rejuvenation. Be sure to look at our website to try to get a little bit more information. You can sign up for that webinar and FemTouch. And today's discussion was about SculpSure, Smart Lipo, and cellulite. I look forward to hearing from you. Thank you.
Good night.
Good night.